Welcome everybody to the March 2025 National Urban League Health Equity Webinar Series on Healthy Aging. My name is Lydia Isaac. I'm the Vice President for Health Equity and Policy here at the National Urban League, and I'm so excited to bring to you our two distinguished guests who are going to fill our minds and our thoughts with how we can support and make sure that people in our community can live long, healthy lives. Live long, healthy lives, not just live long lives. And so I'm really excited to be joined by our two guests today, Dr. Karen Lincoln and Mr. Raymond Jetson. I'm going to let them introduce themselves and talk a little bit about the work they do, and then we'll get into the questions. So I'm going to start with Mr. Jetson.
Hi, I thank you so much for this opportunity to join, and thank you for the important work that the Urban League does. I'm honored, first of all, to share this space with someone that I respect and consider a friend, Dr. Karen Lincoln, who has done amazing work for a long time, and so I'm glad to be here with her. I serve with Aging While Black, which is an initiative that we launched in February of 2023 to elevate the voices and experiences of Black elders and to quite candidly be constructive disruptors to the aging ecosystem, which does not honor the well-being of Black elders, nor pay attention to the outcomes that they are experiencing. We are built around three pillars: recalibrating the village. The infrastructure that supports Black life needs to be transformed to prepare for the aging that has already begun to happen. Second, embracing innovation and rapid change. How do we utilize technology to improve the well-being and long lives of Black elders? And then lastly, leaning into Sankofa. How do we make all of this wisdom and experience that will be showing up in our communities in ever increasing numbers connect with different generations to create stronger families, stronger communities? And I'm glad to be here with you.
Thank you, Mr. Jetson. Dr. Lincoln.
Yes, thank you. It's morning here. It's 10 o'clock. I'm in Los Angeles. So again, I echo what Raymond said, and it's so good to see him. We were both part of the op-ed project, right? And so we worked together to amplify the voices of older adults in the same cohort. And so currently, I'm a professor in the Department of Environmental and Occupational Health in the Josie Nguyen School of Population and Public Health at UC Irvine. And I'm also the director of the Center for Environmental Health Disparities at UC Irvine. And I'm founder and director of Advocates for African American Elders. And much like Raymond, I founded AAAE back in 2012 in South Los Angeles, primarily when I was at the University of Southern California, to really amplify the issues of our older adults and their families in areas that just were not being served, that were not being recognized for the wisdom and sort of expertise that they bring. So we started that, a community coalition in 2012, and here we are in 2025. We have a chapter in LA. We have a chapter now in Orange County, and we focus on primarily health education among our older adults, and our priorities are determined by our community. So whatever it is that they identify as the priorities, that's what we focus on. And we do have a research arm. I'm a researcher as well. And so we participate in community engaged participatory research, which is really important because we got our seniors in their 70s and 80s off the sort of out of their homes, and they are trained to collect data. They are trained to analyze and disseminate data and to set priorities and to influence policy. And so that's really important for us to take, what we talk about and put it into action to make sure that our older adults are engaged and that they are able to interact with our communities across generations and to share their wisdom and their expertise, because they know a whole lot more than we do, because they've been through so much more than what we've been through. And so it's a bi-directional learning experience. I love it. It allows me to do all the rest of my work because I really do believe that what we're doing is important, and it supports our health overall.
I love that. So Mr. Jensen, when you started, you said something about being a disruptor. Can you tell me what is wrong now with, or what is preventing, I would say, are the barriers to healthy aging for African American and other older adults in this country? You're on mute.
It's always better when people are able to hear you when you talk. Well, most of the time it is. I would describe the challenges in a couple of ways. First of all, uh, older adults, particularly Black elders, experience a healthcare system that is largely not respective of or familiar with their culture. And research clearly points that for older Black adults, how we believe and what matters to us influences how we receive health information, how we process it, the decisions that we make. And so, receiving services in a system that measures well-being by a sterile chart, as opposed to the realities that people experience, is a huge challenge. And so I think that true healthcare has to connect in a cultural sense and understand the realities and lived experiences of Black elders. But secondarily, I think we talk about health and we limit the conversation to the healthcare system, when in reality, education, wealth, housing, and so many other factors have been empirically proven to influence people's health and well-being. And so I don't think that we can bifurcate conversations about healthy aging from the conditions in which people experience everyday life. And so for me, healthy aging honors the body, nurtures the mind, but it also happens in the context of culture and community.
I love that. Dr. Lincoln, what are your elders that you're working with? You said you're working in this bi-directional way in a similar kind of vein. What are they experiencing as the barriers? What are they saying that they need in order to try to achieve this idea of healthy aging?
Raymond said, our systems are so fragmented and they are not designed to serve us as Black people. So I recently put out some fact sheets based on some research on Black Californians, and it's like aging while Black. And so what we found is that racism in healthcare was one of the number one issues that was identified, and it wasn't just so what does that look like exactly, right? What does racism in healthcare look like? And so what these 45 and up Black Californians identified was just being disrespected, being mistreated, not being listened to, their pain not being treated adequately. And it was higher among Black women than it was among Black men, but it was high across the board. And so just the way that, when we do have healthcare, many Black Americans, particularly in California, have healthcare, but that is not an equalizer. Right? Whether it's private or public, people are talking about the same kinds of things that they're experiencing, and they're avoiding care as a result of the way that they're being treated in the healthcare system. And so I think those barriers with not just with the older adults that we work with, but across the board, are really impinging on our health. With that said, right, many of us are receiving adequate care. And many of us are engaging in other things that we have traditionally engaged in to maintain our health. And so we still lean on that. The healthcare system is one thing, but we still have access to the other kinds of things that we practice to maintain our mental wellness, our emotional wellness, as well as our physical wellness in communities, which is really important. And so I think in terms of the systems that are there to support us, healthcare systems, mental health care systems, behavioral health care systems, those aren't really existing very well in our communities. And when they do, they don't necessarily serve us well. because the people who are providing that care don't really understand us in terms of what our needs are. And so I think those are some limitations. And so those are issues that we really need to address. And, I really hope that we can find time to talk about what does that look like in terms of having culturally competent providers in an era where diversity, equity, inclusion is being attacked, right? Where we are sort of seeing the decline of our Black, students going into medical schools and going into social work and going into higher education to get that training, because the avenues are becoming a little bit more narrow. And so that's a huge challenge for us in terms of achieving health equity.
And I want to jump in right to absolutely agree with Dr. Lincoln and to name that we're talking about systems, we're talking about systemic issues that are at play, yet very frequently we talk about people's health outcomes as individual experiences or people being able to navigate these complex systems that are not attuned to them culturally or experientially, individually. I believe that it's critical that we have this collective, this village response to what are the system challenges, whether it is with the healthcare system or whether it is the systemic factors at play in the social drivers of health. Was it Dr. David Williams in his TED Talk gave just a really troubling, I had to play it over and over again. He said every 7 minutes in America, somebody dies from something related to a social determinant of health. That's 200 Black people a day, many of them elders who are dying because of things that are related to the environments in which they live, the access to resources in which they have. And so these are systemic issues that need systems responses. And the whole village needs to be galvanized in how we respond.
So, getting on both of your points, I love this conversation. Let's get into it. I think it's important. What is the village? How do we galvanize the village? Right? Those are the two for Mr. Jensen. But for Dr. Lincoln's point is, how do we do that in this environment in which the village is under attack?
Well,
Either one.
I will jump in and say that this is not the first time the village has been under attack in America. And one of the good things about being a Black elder in training and being surrounded by many is that this is not the first time we've seen this script. And so we have been under attack before, and it is necessary that we find community, that we rediscover this reality that we're actually tied to one another, that we are better when we are connected and when we are related. And so to answer the question, what is the village? It is that ecosystem that surrounds the Black elder. For some, it includes family, it includes church, it may include an aging services provider, a healthcare provider, a neighborhood association, neighbors, a community center. All of these things are happening in the lives of aging Black people in disconnected ways. We are going to have to be on the same page in terms of what are the things that are critical to advancing the well-being of Black elders, beginning by, and I love Dr. Lincoln's work, beginning by putting their voices first and out front, and helping them, allowing them to co-create the world that they are going to live in. And so the village is all of those players, and it varies by individuals, but there are institutions and anchors in our communities that have aging Black people as a part of it. You know, I was speaking to someone who is a part of the Divine Nine, and we were talking about the number of members who are reaching that 50-year membership mark. Uh, you know, giving white jackets and pins and calling people seniors is not going to really address the complex issues that are going to be showing up in our institutions. So the village are those places where Black people frequent and show up.
Dr. Lincoln, I'm going to go to you.
Yeah, I think that we need to stop, each of us individually, and think about, who are members of our social network, who are members of our village. And I want to really take a moment to amplify the fact that many of us are thriving. Many of our seniors, despite it all, right, everything that they've been through, are thriving, and have so much to teach us, especially during these times, because they've been through worse, right? And so this is where that wisdom comes in that I think we need to make room for. And unfortunately, we don't often make room for the voices of our seniors who have so much to teach us about how to get through these difficult times. And so I think that when we sit back individually and think about our family members and our friends, our church members or people that we worship with, the people that we work with, because many of our seniors are still working, we do have our village, we do have our social networks. And I want to remind us all that, if you're engaging in your social networks, you're taking care of your health, right? Because social networks are one of the sort of the best things that you can do to keep yourself healthy, right? Social isolation is a killer, right? So people who are experiencing social isolation, it has been compared to smoking 15 cigarettes a day in terms of the health impact of being socially isolated. So the village idea and the reality of it is really important for maintaining our health. And so, I think just to follow up with what Raymond said, we do have our individual networks, and the extent to which we can come together, those networks can come together and build that web and that fabric where we're sharing information, where that information flow is going back and forth, where you know a little bit more about this and I may know a little bit more about this, and we can learn from each other. I think we'll just be better for it, because there's a lot of resources that we may or may not be aware of. And there's a lot of things that are happening in our communities that are solutions that we may not be aware of, because there's no website, or it's not written in some publication, or it's not on television, or we're not talking about it a lot. And so I just wanted to amplify the fact that there are a lot of solutions out there, and the extent to which we share those solutions, the better off we are.
So going with this network idea, and also what Mr. Jensen was saying about um, having our seniors or our elders kind of making sure we have a touch point with them, right? How do we make that connection? I think it's a wonderful connection. You have your Divine Nines and, they become, I'm a Delta, so they'll be Delta Deers, and then, but then they're also at the church, but then they're also possibly still working. And then, but they're also, so how do we bring those networks together to support that elder in whatever they need to thrive? Like, I'm sitting here and I'm thinking and I'm like, we're right. Our networks are important. We got to bring them together. We all have a little bit we can offer to support the community, but how do we make that actionable? How do we do that in a way that is not that we're not forgetting some people, because some people don't have as big as of a network. So then you have the same people getting supported by everybody. But how do we also make sure that we're not duplicating efforts?
Yeah, I'll just chime in really quickly, because, when I founded Advocates for African American Elders, it was just me. I had moved to Los Angeles from Seattle, where I was on faculty at University of Washington, and I worked with the mayor. I was actually appointed by the mayor to chair the Council on African American Elders. And so I found myself in this position where I was speaking on behalf of our seniors to the mayor, saying, this is what's happening, this is what we need. And ultimately, we now have a freestanding funded agency to support African American older adults in Seattle, King County, which we did not have before as a result of the advocacy. So when I moved to LA, I'm thinking, oh, surely there's more Black people in LA. There must be something like this happening in Los Angeles if it's happening in Seattle. And there was nothing, right? There really wasn't this coordinated effort to focus on our seniors. And so I met with people in the community as a new person, who knew more about our Black older adults in the area, and said, you know what, we really don't have anything. You started. I said, okay. So I did. And it was really about reaching out to people, tapping into the wisdom and experience of African Americans who are working all throughout LA County, and saying, I'm not exactly sure what this is going to look like, but I know what the needs are. And we found out that we were on the same page. We were actually sort of playing and singing from the same sheet of music, right? But we were just doing it individually in our own agencies, organizations, and communities. And then we came together, right? So it was really just one person with an idea, wanting to help, but not knowing exactly what to do. And then it becomes informed by people who know what to do, right? Who have expertise in this area, who have shared wisdom, who have access to these communities and these networks. And it became a coalition, right? So now it's much bigger. It's much bigger than we thought it was going to be, because we each bring our individual networks, right, to this coalition, and our experiences. And so those people who aren't connected become connected, right? Those people who may not be aware of certain resources become aware of them, because we are now a coalition and we have our wide networks that we can now share, right? So there's this multiplier effect. And I think, we think someone's going to come down somewhere because they have all this experience and all these degrees, and they're going to sort of come in and take care of these things. No, it's just us. It's just one person seeing a need and asking a question, and it can start from there.
Again, I want to amplify what you're saying, because I think the power of coalition, the power of partnership, the power of working together and not standing on your own, we are all better together. And I know I don't have only my Urban League affiliates on this call, but one of the things I always tell my affiliates is, don't reinvent the wheel. If somebody else is doing it, use what they're doing, and then bring your expertise and your extra special sauce to it to expand it further. So I just want to highlight and just really appreciate you, Dr. Lincoln, for talking about, you brought a bunch of people together. You didn't know what it was going
Yeah.
to be, but said, you know what, we're going to have to figure this out. And a bunch of people said, let's go from the same playbook and come together in coalition and bringing all these resources. So I think that's a really important part of, don't do it on your own. There are other people who are doing it, and let's all do it together, because we're stronger and we can help more people when we do it together. Mr. Jetson.
Yes. So in terms of uh, better galvanizing the outcomes, the experiences, the village of Black elders, uh, at Aging While Black, we believe that first and foremost, the voices of Black elders need to be elevated. The agency of aging Black people needs to be respected, and we actually need to create space for it. So very often we show up with a mindset of helping without listening to the voices of people themselves. And so I think that we need to intentionally create space for the voices of Black elders. Where there are family structures in place to support, the family becomes the coordinator of all of those various tentacles of that ecosystem surrounding that the Black elder that is in question. Dr. Peter Attia, in his book Outlive, has a really critical question that galvanizes the whole aging experience for him. And it is, what do you want to do in the last 10 years of your life? What do you want to do? And and it brings this question of healthy living, health span as opposed to lifespan. And I think that if we start asking the question, what do you want to do? What do you want to be able to do in the last 10 years of your life? And start backing up from there and making certain that the congregation, the social organization, the aging center, that all of the folks understand that this is what we are working toward, and thinking about centering the person rather than the programs, the systems, the strategies that constrict, in my opinion, the well-being of people as they age in America. I believe that that is a critical element that needs to happen also. And so it starts with the person who is aging, where there is a family. If there is not a strong family that is surrounding the elder, then where are there those, whether it's in a congregation, who are those others who can step in, those neighbors who are concerned to help make certain that there is communication across the spectrum of people's experiences? Because as Karen pointed out, there are solutions that are out there, but so very often people show up in spaces and we're not aware that this is a need or this is something that is being worked on or that should be worked on.
I also want to talk a little bit about something you said, this difference between a health span and a lifespan. Um, uh, Either one of you can take that, but I think it's important for us to talk about this idea of healthy longevity. And there's your lifespan and then there's your health span. So either one, and then we can have some time talking about that, why that's so important.
Well, I mean, lifespan is how long you live. Health span refers to the quality of the life that you live. You know, we measure uh, uh, lifespan through death rates, and life expectancy and these kind of numbers that don't give any attention to the quality of that life. And Karen mentioned earlier about the healthcare system and how it responds to situations. A system that's driven by lifespan is why we end up with the preponderance of people's medical costs being spent in the last few months of their life, because the system cranks into full gear to just simply keep you alive rather than on the front end being designed to lessen the likelihood of those things that will lead you to needing all of those interventions later in life. And so it is a total mindset shift in how we approach this notion of health in America. But as Dr. Attia said, healthcare in America is not about health, it's about commerce. And when we understand that, it unlocks a lot of the perspectives that we see in healthcare. It's a method of transferring currency. The well-being of people is a byproduct, in my opinion.
Mm. Dr. Lincoln.
Yeah, I absolutely agree. If we look at the Commonwealth, came out with their new report that they come out with regularly, and it showed pretty much what they've shown before, and that is that the United States spends, if you take all of the developing countries together and look at how much is being spent on healthcare, the United States outnumbers all of these countries put together, right? In terms of how much is being spent on healthcare. So there's that. But the US is lowest in terms of health outcomes, right? In terms of healthy populations and healthy people, the lowest, spends the most, but has the worst return. And that is because of the way, that we do think about healthcare. And so I think in terms of health span and lifespan, I absolutely agree with Raymond that we want more years of healthy lives versus just more years of living. There's chronological age and then there's biological age. Those two things are not the same. Unfortunately, on average, Black people have a higher sort of biological age compared to white people of the same age, right? So we could be 7 to 10 years older biologically, but we're the same age as, say a white person, right? And that's because of stress and all the accumulation of all of the things that we're experiencing that age us faster, our brains, our bodies. And so we tend to see diseases that we should not even think about until much later in our lives. We're starting to see them at 35, right? And 40 and 45 being diagnosed with these chronic, illnesses. And that's chronological life. That is lifespan. That is not health span, right? And so we want to make sure that these numbers that we tend to hear a lot about in terms of diabetes and hypertension and dementia, that we don't see that until much later in our life. That is a health span. We want to increase the number of years without these diseases. And I also want to just say that we can still live with these chronic illnesses, right? Being diagnosed with any of these things doesn't mean that we can't have a healthy life. And I do want to highlight that there are ways to continue to be healthy, even though we might have some of these chronic illnesses. I think it's really important that we highlight the fact that health can be defined however we decide to define it. It's not just the absence of disease, but if you have some of these chronic illnesses, you can still be healthy. And one other thing I wanted to mention before I forget, we tend to use words like unhealthy behaviors or maladaptive behaviors when we talk about, how we might eat, or we might sit and watch TV, or we might have, comfort foods, or we may not exercise as much as we should. We might drink a little bit more alcohol than we should, or smoke, more cigarettes than we should. Many of the experiences in terms of health behaviors that we find ourselves in as Black people is because we're coping, right? You have a bad day, you go out in the world and you're experiencing all the different types of social stressors, including discrimination. You go home and you might drink a little something, eat a little something, sit in front of the TV, right? Because that's what you have access to, right? If there's a really nice, culturally competent mental health, agency in the neighborhood, maybe that would be your option. But those things don't often exist for us, right? And so we are engaging in behaviors that make us feel better, right? Now, they may make us feel better in terms of our mental health, but they have detrimental impacts on our physical health, which is why we see much lower rates of depression, but higher rates of chronic health conditions, right? Because we're engaging in behaviors that make us feel better in terms of our mental health, but they're not doing much for our physical health. And so I think when we think about, how do we deal with these social stressors? Because a lot of our stress is coming from external, right? There are just few options that are presented to us in terms of how do we deal with these stressors. And I think within healthcare systems, if you're just thinking about how we're behaving, eat better, exercise more, but you're not connecting these behaviors with what we're experiencing in the world, we're missing the mark. We're missing the mark. And I will say just one last thing in terms of the studies that I did from listening to Black Californians. That's the name of the study, listening to Black Californians. Exercise was sort of the low 3, options that we're doing to engage in healthy behaviors. It was like the bottom 3, right? But speaking up and talking to our doctors when we're not being asked about our health was the top, right? Engaging in preventative care, making sure we're getting our screenings, that was in the top. So I do want to amplify that we are taking matters into our own hands to take care of our health. It's just that, exercise more. It's just not one of the things that we're doing often, but we are doing a lot of other things to maintain and improve our health. And I would like to amplify that, they may not be sort of listed in the sheet that you get from your doctor, do these things more or less, but they are working for us.
And kudos to speaking up. In the book that I referenced earlier, Outlive, it described exercise as the most potent longevity resource or something to that effect. And so we certainly do need to do that. When Karen was talking about all of these factors, these external stressors, it reminded me, uh, Dr. Arlene Geronimus, in her book Weathering, talks about how uh, these seemingly benign factors actually accelerate aging. You know, the conditions in which people live, the stressors that aging while black or living while black in America brings with it. Uh, that they accelerate aging and deteriorate health in people. And then she goes on to chastise the larger systems by saying that unfortunately they have this preoccupation with genetics and individual responsibility and personal responsibility that have not allowed them to consider other possibilities to what is actually happening. One last thing, you know, there is a really robust conversation happening in this country around geroscience. You know, this notion of how we are able to delay this chronological aging. And I had an opportunity to participate in a geroscience event at AARP with the National Academy of Medicine, I think, and AARP. And the critical question is, when this technology advances, will it actually be accessible to the people who age faster and die earlier? And the likelihood is that if history is any instructor, that will not be the case. That questions of access to resources that address these really complex issues are really challenging and will continue to be so.
No, I thank you for that because it brings up a couple of points from when you were both talking. I was thinking about this idea that one, I'm going to go back to this idea of healthy aging because we're all going to age, right? Even with geroscience, it doesn't mean it's going to stop the aging process. It means that it helps the process so that it maybe it's not, I won't say not as destructive, but that people are not as sick as their age. I actually also went to not the same one, an ARP conference last week where they were talking about the fact that until 1900, most people only lived to the age of 50, right? And now we are living in our 70s and 80s because of technology, right? Vaccines, helping, kids going to school, but really vaccines has helped us basically not get killed off by bugs, right? And so for that reason, we're living longer, right? And our bodies, whether we know it or not, are now living longer than they ever have in over a century. So we're living 30 years longer, 20 to 30 years longer than anybody any century before that has lived. And so what geroscience can help is to reduce some of the aging process on your bodies. But it's important to understand that we're all going to age, right? And there's greatness in aging, right? There's nothing with aging. What we want to be is go back to what both of you have said, is the quality of life you're living while you're aging, being able to still participate in your community, in your village, in your family, and in whatever it is you want to do in a way that is best for you. And so I think what I want us to talk forward in the next, 10 to 15 minutes or so is how do we accomplish healthy aging? How do we make sure that Black elders can do the things they want to do? Like you said, Mr. Jetson, in the last, 10 to 15 years of their life, wherever that may lie, how do we make sure it's the best last 10 or 15 years that they're being able to live their life to the fullest without we are going to have impairments from aging because our bodies are just, this vessel is not meant to last, you know, forever, as far as we know right now. Who knows what the science is going to do, but right now it's not meant to last forever. So how do we make sure the vessel can support people in living the life they want for as long as they can?
Well, I can start. So you're right. As soon as you're born, you're aging. So let's just be clear about that, right? So we start aging on our birthday, our first one, and it goes from there. And so one thing I really want to stress with respect to healthy aging are our social connections. I mean, we really need to highlight the importance and the health promoting and health restorative aspects of social connections. It can be in person, it can be virtual, it can be on the phone, it can be letters. Um, and I think many of us have these connections, some of us don't, right? Some of us don't. And we see the consequences of the lack of social connections with respect to our brain health, cognitive decline. We saw it go up tremendously during COVID and during social isolation and social distancing when we weren't able to maintain those connections. We saw the cognitive decline, we saw the physical decline of many of our seniors because we just, we didn't really sort of talk a lot about what would social distancing, what impact would that have on our seniors who need to be with their families, who need to be with their neighbors, who need to go to church, who need to volunteer, who need to go to the senior centers. And so I'd like to highlight the importance of that. So if you're, wondering about what you can do to support healthy aging, stay connected. If you're playing dominoes or bid whist, if you're a member of fraternity, sorority, church, mosque, keep doing those things. And then also exercise your brain, right? So you don't have to play, crossword puzzles or Sudoku and all those things, Scrabble. Just take a different way to the grocery store. Take a different route to church, take a different route to school. Don't get lost. I get lost all the time, but I have GPS. Thank God. If I didn't have GPS, I wouldn't even be here right now, honestly. And I'm in my house. So, so it's really important. And when you're playing spades, right? When you're playing dominoes, when you're playing bid whist, let's be clear. Those are not easy games. I don't play because I don't want to get yelled at. It takes a lot of cognitive demand to play our games. You are exercising your brain every single time you do that. You don't have to do the crossword puzzles. If you do, that's fine. But ways to keep your brain active. And even if you're by yourself, you can do the crossword puzzles. You can do, the games and things like that on your own, as long as you're keeping your brain active. These are things we do all the time, and we may not even know that they're good for our health. And so if you like to spend time alone, there are ways that you can engage in healthy brain activities. If you like to be with other people, keep doing that. So I think, one of the healthiest ways, honestly, that we can sort of improve and maintain our health is through our social connections.
Can I just, before you,
Yeah.
Jetson, you say, I think it's really important, but that you said any way possible. I think some of it, kind of takeaway for our audience today is, pick up the phone and call an elder that you haven't talked to in a long time, right? Write a letter. People don't send cards anymore. I mean, unfortunately, she recently passed, but my godmother, I used to send her a card every Mother's Day, and she never forgot that. She was like, no matter where I was, you always sent me a card, right? And I may not have talked to her all the time, to be honest with you, but I always sent her a card every Mother's Day, and she never forgot that until almost the moment that she passed. And so I think it's important to remember that these small things, and texting now, all the elders are into texting now. My mother does things that I don't even understand how she knows how to do, but she does. There's all sorts of emojis happening. And so just sending a text, my nephew is in college, and my mother was so excited because he just randomly sent her a text and said, Grandma, I was thinking about you, and I just wanted to check in. Right. And this is a 19-year-old kid. But it meant so much to her to have that happen. And so I think it's important for us to understand that connectedness doesn't mean you have to go out and take them out every day. That would be great, spend a weekend with an elder, but a phone call, many of them still have landlines, a text message, a note, a letter really goes a long way in making your loved ones or any senior, that from the church, from the corner store, we all I'm a New Yorker, we travel on subways, sometimes it's the same person you see and it's that same older person just getting up and giving somebody a seat, is those are the kind of things that really do help with connectedness. So I just want to point out that you don't have to make grand gestures. You can do small things that make a big impact. Mr. Jetson.
Yeah, so Karen's mention of all of those wonderful cultural artifacts, spades, bid, whist, dominoes, etc., brought to mind an initiative that we are piloting with Aging While Black that we have branded When Old School Meets New School. And it is bringing together the generations around dominoes, spades, bid, whist, Uno, uh, and creating space for these intergenerational conversations. Also, the passing down of cultural traditions. You know, talking smack while playing spades is a cultural tradition that needs to be passed down. But also it gives an opportunity for brain activity for because these are not simple things to do. And so it brought that to mind. But what can we do? I think it begins with adopting a different mindset around what it means to be healthy. You know, it's not simply what the numbers on a chart say it is. You know, it is holistic. It is something that honors my body. I do need to take care of this thing because it keeps what's inside of me here. And so taking care of the body, but it's also the mental and the emotional well-being. You know, mental health is a part of health. It's not something separate there. And so how do we nurture the mind and make certain that it's there? But I also think this notion of community. You know, healthy living happens in community. And so, how do we make certain that we are attentive to the body? You know, the tests, those things that lessen the likelihood of all of those conditions that we are challenged by. Also, how are we attuned to our mental well-being? How do we move beyond the stigma and the cultural challenges of mental health and accessing services where they are? But also, how do we make certain that community and culture are part of how we understand somebody's health?
Yeah, I think that's really important. Before we go on to the last set of questions, I do have one comment in the question and answer that I want to get to. And if anybody has any additional questions, please make sure to put them in the question and answer. So the comment from Jeffrey Johnson, thank you, Jeffrey, says, excellent discussion. We should have a universal generic checklist concerning our health that we should complete and provide to our primary care provider during our annual and or semi-annual checkups. As a Black man in my 60s, I only have a conversation with my primary care physician during my annual checkup. In essence, we need a closer relationship with our primary care doctors. The irony is they are overbooked and overscheduled. Very true.
So one of the things we are working with the H Friendly Health Systems and IHI, who've developed the 4 M's for healthcare providers. They are now piloting a pamphlet called My Health Checklist that provides a set of questions and issues for people to prepare when visiting their primary care physician. We are working with them to ask questions around cultural sensitivity and how well it connects with aging Black folks. And so there are things that are emerging, but we need to make certain that they are responsive to our lived experiences and our realities.
Mhm. I know also CMS is working, well, they were working on some things. I think they still are. I don't know. I'm gonna not wade into that pool. But CMS was also working on some things that might be connected. CMS is the Center for Medicaid and Medicare Services, and are working on some tools to work with the annual Medicare annual visit to see if they can make some connections with make exactly what you were saying, Mr. Jetson, with making it easier for physicians and patients to talk through what's going on. But you're right, you only see your doctor sometimes once a year for an animal visit. So, and many of them are stretched, particularly primary care physicians only have 15, at most 20 minutes to do these visits. And, getting through everything is not always easy. So, as you said, as we started off, the system doesn't necessarily always help with helping seniors to get the care they need in the healthcare system. And then we also have to think about the environment they live in to make sure that that environment is supportive of healthy aging and healthy whatever they need to do to stay healthy. So I think that's really important for us to talk about the system and then the environment. So I always like to end or come to the end of these with, we only have about 9 minutes left, is sitting on this call not only is you know urban league affiliates from across the country who are in different environments, who are in different counties, some of them super urban, some of them suburban, some of them urban and rural. And so I want you both to think about, I love your this idea of the village. So what are some actionable steps besides what we've already talked about that urban league affiliates, they see lots of people from the whole generation, from the children to the older adults. What can they do to support healthy aging in their community? There's deep thoughts happening right there, Mr. Jetson.
Start with that. So, it doesn't take much to go knock on a neighbor's door, right? Because, and I think that, we need to decide that we are as responsible as anyone else for our older adults. And, as we talked about before, the simplest thing, it's like butterfly wings, right? The butterfly wings, the butterfly effect, right? It can just cause a tsunami on the other side of the world with something really, really small. And so, first of all, knowing and understanding that, we as part of a village, as part of a community, have the responsibility to take care of our older adults. They don't have to be related to us by blood, right? But they are part of our community. And so I think the extent to which we can feel and be more connected to our older adults is really important, because I think connection it's not everything, but it definitely is key. And so I want to focus more sort of on the solo seniors, those who aren't connected. Like, how do we, take care and maintain relationships with them? We have to find them. We have to sort of have connections to identify where are our seniors, particularly baby boomers many who did not have children, right? We have to think about, not everyone has a family, not everyone has children. So identifying, helping to identify who are those older adults who might be living alone, may not be lonely. Some might be lonely, right? So I think that, and so it's not just reaching out to an older adult or a senior, whether they're solo or connected, it does something for us too. Right. It does something for us too. So I think just, thinking about how, taking health, as Raymond said, in a more holistic way. It's not necessarily a healthcare provider. It's just, we can take matters into our own hands. And sometimes the smallest gesture can mean the world to someone in terms of maintaining their health. And so I think, again, with the coalition building, sharing resources, and being able to communicate with each other about these resources so that we can all learn together and move together and grow together and age together is really important. And I want to say one last plug. We started a new research project, partly because of the listening to Black Californians, when we saw just the percentage of Black people who said their pain was not adequately treated. Black women, 50% were saying my pain was not treated. Pain is associated with our brain health, right? It causes inflammation in our bodies, and it creates all kinds of unhealthy issues. And so we still need research, because there's so much that we don't know that's sort of feeding into some of the unhealthy outcomes that we have, particularly with respect to our brain health. And so in addition to more research, looking at stress and pain and how it's affecting our brain health and the rest of the systems in our organ, we also need to focus on the things that sort of help stimulate that brain activity, some of the things that we talked about that are cultural, and to sort of congratulate those of us who are engaging in those behaviors and didn't even know that we were sort of supporting our brain health and keeping ourselves healthy. So kudos to all of you. who are doing things you had not, maybe didn't even know that you were doing to maintain your health. If you aren't doing those things, please just consider doing one thing, just one thing, a quick walk, right? A glass of water, try to go to sleep a few minutes earlier, right? Try to create a healthy sleep routine because sleep is everything. It's the most elusive thing, but it's one of the best things that we can do for our systems. And so get good sleep if you can't do anything else, and reach out and connect with someone.
Can I add one thing to your easy kind of changing things? I read this somewhere too, or I heard it somewhere. Changing the hand you use to brush your teeth
Ah,
trains your brain in a different way. So it's little
yes.
things. I just want to
Yep.
say those little things that everybody can do, no
Yep.
matter what physical capabilities you have. Most of us, I hope all of us, brush our teeth at least once a day, should be twice a day. So change the hand if you're right-handed, use your left hand. If you're left-handed, use your right hand. It helps your brain actually think differently because you're using a different modality. So
That's
I,
right.
I, I want to highlight those small points. Mr. Jetson.
And I'm going to add to that a little bit, not only change hands, but consider while brushing, standing on one leg. It deals with balance and forces your brain to work in a different way. And once you get down pat, then try closing your eyes while you're standing on one leg and brushing your teeth. And see what happens. In terms of this coalition building, at Aging While Black, we're trying to build a national coalition. We're inviting people to join the Aging While Black movement. You can go to agingwhileblack.co, not com, .co, and connect with us. In April, we're going to be launching the Aging While Black Network, where entities and organizations can connect nationally to create this ongoing sharing of spirit and effort. In terms of your affiliates, I would encourage them, look at the programs, the services, the strategies that you are implementing and executing, and ask yourself, are they prepared for older people to show up in them? As older people start to work longer, are your workforce programs equipped to be accommodating to older workers as much as they are younger workers? As you are providing services to people in whatever communities, pay attention to who's actually providing caregiving services. Are there ways that you can serve as a connector to those resources that are often hidden in plain sight in our neighborhoods and in our communities? Become a part of the village that surrounds aging Black people in your community.
So, of course, at the end, the last 2 minutes, we got a bunch of questions. I'm going to get through them quickly. Most of them are comments. Somebody, I think, wants to know where they can get the pamphlet that you held up, Mr. Jetson, and also to connect with Karen's resources through the communities that she's working with. So we can put that information in the when we send out the information, we can put it in the chat. So if you can send me that resource or where they can get it, I can get it out to folks. Most people were saying thank you and also getting a therapist. But we do have one quick question about, which is a good one from, thank you, Michelle Scott, about worrying about trusting in the community and somebody exploiting older adults, thinking that the person is, helpful and especially when people have dementia or Alzheimer's. Thank goodness, Ms. Scott stepped in, but how do we protect seniors from people trying to exploit them?
Unmute. That is it's such a good question and so difficult. It is
Yeah.
so difficult. And so I think, my own mother who has dementia, who had let everybody in the house before we, and changed everything. She has daughters, right? So we were able to step in and hoard off the people who were engaging and trying to engage in fraudulent activities. And so again, this is something that our adult children need to be aware of. If you have a parent or an older relative who's living alone, just accept the fact that they may be vulnerable to fraud. Just accept that fact. Even if they are cognitively well, if you believe that they're able to maintain their finances, if they're living independently, and even if someone else is in the home, just know that it is likely and it is possible. And so you want to make sure that you're able to go and look and see if any mail has come in. Ask, has anyone come by? Because some people will come and they'll knock on the door, look at the phone, and see if there's any scam or anything that's popping up on their phones. But I think it's really, you want to be on high alert, right? And don't assume that it's not happening, because the way that it's being done now is just so smooth. It seems very reputable. It seems very credible. I just got a call from my credit union, and it wasn't my credit union, right? Same number, right? And so I think we need to be very, very aware and on high alert. It's very difficult. It's very difficult. The only thing that I can say is to just, if you just assume that it's happening, and that you assume that older adults are vulnerable, you can be hypervigilant and start checking and making sure that they're not being targeted.
No, I think that's a really good point. Mr. Jetson? No. Great. Well, we are actually over time, and I do want to respect folks' time. You got to thank you so much. And you got lots of thank yous and great ideas, particularly around the bid whist and the fact that it's having people's brains, it's true, have people play more games. So I just want to thank you both so much for taking the time out of your busy schedule. And we have to say, today's Dr. Lincoln's birthday, and she still took the time to do this with us. So I just want to say happy birthday to you. You are a treasure, and we so appreciate you for taking the time on your birthday to be with us. Thank you for all of you who are being here. Thank you so much for Mr. Jetson. Please also go to his website, look at his TED Talk, which is excellent, and use the information that's in it. Thank you all so much for healthy aging. Remember, we are here. We have to check on our seniors. We have to be with our seniors. We have to incorporate our seniors into our villages and make sure that they can pass on their wisdom to the next generations and generations beyond. Have a wonderful day, everybody. Happy spring. And I wish everybody the best. Thank you so much. Bye-bye.
Thank you. Bye-bye.